Hey YouTube, it's New Life for Jen or Jen. I'm on my own channel today, which is C&J 1977, and I'm coming on today for a quick update. Today is August 5th, 2012, Sunday, and I'm coming up today to give you guys some news and also just to let you guys know how my fill went and weight, etc. I'm 16 and a half months post-op. 6.5 months in maintenance, post-op Lapband. I had my surgery on March 18th, 2011. My starting weight was 264.8 pounds, and today I was at 134.2. So that's not bad for a Sunday. I've been kind of doing this, kind of Friday, Saturday, Sunday, you kind of do what you want, and then Monday, Tuesday, Wednesday, Thursday, Friday, you're totally on track as a perfect Lapband patient, and it's been working, and I'm finding my balance, so that's what is important for me. Other than that, I have some news. After Vegas, I had my couple plastics consultations, one with Cosmed. I was really, really happy with their program and Dr. Q, and the ones I got from the other doctors there, I knew they were going to be very highly priced. I knew I wasn't going to be able to afford it. So I contacted the company that I had my Lapband through and to see if they had any in-network or doctors that they recommended, and they actually do have a doctor that's through their same kind of practice that does plastics and, specialized in people that had weight loss surgery. So that was something that I wanted to get a quote from. So months ago I had turned in pictures to them, full body pictures, ones you don't want to send to anybody, embarrassing pictures to me, to show them where I was at, skin-wise, the areas I was concerned about, and waited to hear back from them. I heard back the same things I heard from the doctors in Vegas, breast lift and augmentation, a 360 body lift due to the massive amounts of skin I have on my bottom butt area. You guys have seen my stomach skin. It is very flat, very minimal, very thin. I mean, they're still going to be able to fix it, I hope. Of course they will, but I'm saying my main concern is actually in my back area and my thighs. So, I originally had thought that they could do all of them at the same time. They had came back and said no, it would have to be split into two different procedures, 360 and then breast and thighs. Well, I was like, I really want my breast done. That's my main concern. So I'll have my breast and thighs done and then worry about the 360 maybe at the beginning of next year. Well, he came back and said for me to get the optimal result with my thighs, it's best to have the 360 first. So I was really on the fence, and I was on the fence about this whole plastics anyway. I knew the breasts were going to be done regardless, but the rest of it, I didn't know if I wanted to go that far. In a lot of ways, justifying spending the money on myself to fix my own, pretty much the damage I did to myself. You know what I'm saying? To spend that kind of money to fix 20 years of bad eating, I don't know. I also found out that my insurance does cover more or less excess skin, but I don't know. I don't want to try to lie and say that I have issues to try to get covered through insurance, and I would almost have to do that. I don't have scars, or I don't have rashes, or, blisters, or anything like that, so I thought about that last week, and I'm like, you know what, I can't justify trying to tell a company that I'm having issues that I really don't have, and I kind of would feel guilty even trying to ask my insurance to pay for it, just because of the fact that they do not cover bariatrics. I did have to pay for my Lapband out of pocket, so by the time I would have to come through and pay my 20%, it would probably be equal to what I would have to pay in Mexico. So I am going to follow through, and I actually booked my 360 body lift for October 4th, 2012. So in about 7.5 weeks. I'm nervous. I am scared to death. I am not scared at the fact that it's Mexico and that any of that. I mean, I have no worries with Mexico. I've looked at this doctor. I've talked to people personally that have went to him. It is Dr. Suarez, and it is CER Clinic, C-E-R, and then Clinic. That's in Tijuana, Mexico. It'll be the same kind of thing like my Lapband. They will pick me up from San Diego Airport. They will take me over the border. My surgery will be done there. He's telling me in 48 hours I can come home. No. I'm thinking maybe we'll stay 5 days, 5 to 7, depending. I don't know. I have so many things, like, I don't know. I'm scared. The thing that I'm scared the most about is downtime. I'm not one that can sit still very well. And I remember watching Sarah Will Be Skinny after she had hers, and I know her skin was, a big issue, and it was a lot of skin that they took off. And I remember just that one video with her on her couch and her crying because she just wanted to move. And, that scares me. I'm not a very patient person, and I'm not a very sit-still person. So this is going to be a big deal for me. But out of the whole year, October 4th through that time that I would have to heal is about the only time of the year that I can do this. So it's, I guess, meant to be. I was really thinking that I would be going to get boobs and thighs, but come to find out I'm just going to have the 360. And then we will go breast lift and augmentation and thighs. Probably I'm thinking January, February. He wants me to wait at least a full 60 days, which I wouldn't be able to jump right back down there anyway for the other two. And I'm not sold on the inner thighs yet. Like, I need to do some more research. I need to actually call Sally and speak to Sally about it. And I know everybody's results are a little bit different, but I don't want to go through something medically like that if it's not going to give me the improvement I want. So, I don't know. I'm on the fence with the inner thigh lift. I'm very excited to see what this 360 is going to do. I've seen great results on some of our fellow YouTubers that have had the 360s, just lifting of the outer thigh and the butt area. So those two things I'm interested to see. The one thing I just wanted to really let everybody know is I will be on here documenting like crazy with any of these procedures I have done. There is tummy tucks and 360s out there right now on YouTube. Did not find a lot of inner thigh lifts at all. Sally came up, of course, and just a couple other of these like doctor things, but no personal people. So if I do decide to go for the inner thigh, which I'm sure I end up will, but everything will be documented because I want to put out as much information back, and especially for Mexico, because that's like the cliche place to go anyway, but I'm 100% comfortable there. I was for my Lapband, and I know I will be for this, and this company takes great care of their people, and so I am set. October 4th, 2012, my 360 will be done. Like I said, I will document like crazy. AC meet and greet is in like, I don't know, like 13, 12 days. So when I get back from that, I am going to hopefully come off of a major back restriction, and hopefully I'll be able to modify insanity to what I can do. I want to tighten and build as much muscle in my core here in the next 6 weeks after the meet and greet, before the body lift. I want abs in there. I want to be lean. I want to be fit. I want to be healthy. I want to pack as much protein as I can in my body in the next 6 weeks. I need to start a different vitamin regimen. There's just a lot of things that I have to change here and to prepare my body for, because I want to be in the best physical condition I can be for the surgery so I can promote the healing. And that is going to include here figuring out how I'm going to quit smoking, because I'm scared of that, and and the 360. I want to heal, and I want my scars to be good, and I don't know how I'm going to handle that yet, but there is always other options, so I will keep you guys posted on that. But anyway, that's my update. I just wanted to say a quick thank you to everyone that messaged me on my own channel and on the Back to Basics channel, the comments for my video this week on sex after weight loss. I appreciate it. I'm sorry I got a little emotional, but my life's an open book, and it's heartwarming and personally satisfying, and makes you feel good when you're not alone and there's other people out there going through similar situations. And I don't know, you guys make me feel like I'm not alone sometimes, and that there are others out there experiencing the same things, and that's what the whole YouTube community to me is for, is support anyway. So I appreciate all the comments. I need to get on there and respond to everybody, but I love you guys. We're already at 11 minutes, and I will keep you updated as we go through this process. Talk to you guys soon. Bye.